So I joined UHS in 2018 after completing the scientist training programme, and I specialised in radiotherapy physics. So when I moved here, I joined the QA and dosimetry team. But I've always had an interest in informatics and computing, but I didn't really consider it a career at that point. However, I got involved in treatment planning system scripting and development projects, and eventually I was spending more time with our scientific computing team doing software testing. And then not until recently, I actually joined the scientific computing team full-time. It's very varied, which is what I enjoy. A large part of my job is software testing and validation of our in-house software. But I'm also involved in scientific projects and development work, such as enhancements to algorithms or implementing some new evidence-based technique or something. I'm also on the kind of interface between the clinical radiotherapy team and the scientific computing team, so I do a lot of user engagement sessions. We focus on user-centric design, so gathering requirements for the software. Also, I'm involved in some training, so I've had some summer placement students as well. So yeah, it's a very varied role. UHS is a great place to work because there's a large focus on always improving and on innovating. And I've always found everyone very supportive when I've wanted to develop myself, whether that's technically or more personal development, such as leadership. So yeah, I'd just say it's a really positive place to work. My advice would be to always stay curious and not limit yourself to learning skills that are directly in your core discipline, because that's where I think I held myself back. I didn't necessarily know there was a career in this area, but once I found out there was, it opened up the doors to develop myself. So I'd say stay curious, try and get involved in as many projects as you can, even if it's outside your comfort zone. That's the place where you grow the most. So I'm relatively new to this team, so my immediate steps are improving my skill mix clinically and technically, and then going forward I'd like to take on more responsibility in software testing and hopefully move into a more leadership focused role.